Right, tonight we are also learning more about the upcoming end to emergency COVID regulations. And while it was announced by President Joe Biden yesterday, tonight we are learning more what this means for people needing COVID testing and treatment.
Our Washington, D.C. correspondent Rachel Knapp now joining us live from the U.S. Capitol on this story tonight. Good evening, Rachel.
Good evening, Mike and Eva. This announcement from President Biden is kind of a response to House Republican proposals on COVID. Specifically, some Republicans are looking to end the emergency declaration as soon as possible, and they're trying to end the COVID vaccine mandate for healthcare professionals.
Under the guise of COVID-19, Democrats' authoritarian policies weaponized the federal government, forced unconstitutional vaccine mandates, and cost hundreds of billions in waste and abuse of Americans' hard-earned taxpayer dollars.
House Republicans say it's been 2 long years of Democrats' power grab policies, and their goal this week is to pass legislation relating to COVID. The Biden administration argues an abrupt end to the emergency declaration would create wide-ranging chaos and uncertainty throughout the healthcare system. They add that under the public health emergency, the Medicaid program operated under special rules to provide extra funding to states to ensure that tens of millions of vulnerable people kept their Medicaid coverage during a global pandemic. Now, last month, Congress enacted a orderly reduction of these rules to ensure that patients didn't lose access to care unpredictably and that state budgets don't face a radical cliff. Democrats didn't argue that the severity of the pandemic has shifted, acknowledging that for the most part people are back to their normal routines, but they argue that state and federal agencies as well as people need to be prepared for when that declaration ends.
This immediate reversal offers no off-ramps for relief programs and benefits, threatening aid for nursing homes and hospitals, additional support for the VA, as well as help for small businesses and more.
Now, during this pandemic, people were able to get free COVID tests and the vaccine, but ending the emergency declaration will change that. Charges for testing, treatment, and the vaccine will vary depending on if you have Medicare coverage, private insurance, Medicaid coverage, or no healthcare coverage at all. Now, Pfizer and Moderna have already said that their commercial prices for the vaccine will likely be from $80 to $130 per dose. And tomorrow, Mike and Eva, we can expect a House committee hearing on COVID, federal COVID spending, and we can, of course, expect Republicans to really kind of criticize how much funding has been spent on COVID these past couple of years. Back to you.